Hi, it's Eric Hartman with the Choroideremia Research Foundation, and I am here with Molly Marra, who is a genetic counselor at OHSU out there in Portland, Oregon. And she works with one of our great researchers, Dr. Mark Panisi, and others out there. And why don't you talk to me about the role you see? I've always thought that genetic counseling is so important for families when they get a genetic diagnosis.
Yeah, I really think of genetic counselors being important for helping patients understand and interpret their genetic information, as well as cope with the implications of the genetic information, both for themselves but also for family members.
Yeah, well, we have, as a foundation, I've actually done presentations with the American genetic eye counselors, and have actually been at one of your meetings out in San Francisco a couple of years ago. And I also work with the UK eye genetics group there. And it's really, really important for us to allow the genetic counselors, you're on the front line of giving support to the patients, and it's really important for them to know that we are here as a resource, even on a global basis. But you may want to also give a few of your thoughts on the importance of making sure the mothers are tested, and potentially even the siblings, and why that might be important.
Yeah, I think that, because choroideremia, because of the inheritance pattern, we frequently see families with multiple generations affected. And females often assume correctly that they are carriers of choroideremia, but may not undergo testing themselves because of that assumption. Testing female carriers really gives us the opportunity to both monitor them for disease symptoms themselves, as well as test their children for whatever mutation is found in them.
And we as a foundation are funding research right now to further our knowledge of what carriers might have as symptoms, so we can better help our female carriers as they progress in life. There's lots of neuroprotective agents and other things that may be able to lessen or stop the disease, but we don't know it unless we definitively understand the diagnosis and what is called the phenotype, how the disease progresses. So for any of you who are female carriers, keep an eye out. We already have a study underway, but I think it's important for you to get checked on a regular basis to make sure everything's healthy with you as a carrier. So that'll be it. Thank you, Molly. I appreciate you stopping by.
Thank you so much for having me.